Good evening, and welcome to another edition of the Rankin-Mon Valley Pittsburgh section of the National Council of Negro Women program, NCNW. My name is Valerie Waters, section representative for the Good Health Wins Partnership and president of the Pittsburgh Club of the National Association of Negro Business and Professional Women's Clubs, Inc. We want to thank all of you who have participated in our programs in the past and for joining us again today. Should you have any questions during the program, please call 412-953-9583, and that number will be at the bottom of the screen throughout the program. Thank you. First, I'm going to discuss what is Good Health Wins Partnership. The Good Health Wins Partnership is a component of NCNW's national program for the Future to historically focus on issues and disseminate information affecting African American women and their families, as well as to promote healthy lifestyles and behaviors through wellness projects. Good Health Wins Partnership is an advocacy network of nonprofits working together to raise awareness of the impact of timely immunization for people of all ages and protect families and individuals from vaccine preventable disease, especially in the minority community. Currently, our focus is on the urgent COVID-19. If you have an opportunity, please go to goodhealthwins.org website and take the pledge. I think you'll find it very worthwhile. goodhealthwins.org website and take the pledge. At this point, I'm going to pivot a little bit and talk and put on my other hat for the Pittsburgh Club of the National Association of Negro Business and Professional Women's Clubs, where we are protecting. Next slide, please. Our mission is to protect the interests of African American business and professional women, to serve as advisors for young people seeking to enter business and the professions, to improve the quality of life in our local and global communities, and to foster good fellowship. The National Association and the Pittsburgh Club has historically recognized a critical link of developing programs in the area. And tonight, Think Hard, Think Health. This is a program that the association has had since 1996. Our Founders Day program, where we recognize our national and local founders. Women History, where we recognize women in health and other things. This year is promoting and healing health. Entrepreneurship, where there's technology training, a combination of technology training, and also how to start a business, how to finance a business, and things of that nature. Our annual scholarships on a national, district, and local basis. Our vocal arts, which is a classical vocal arts program, where typically Black young people are not given an opportunity to compete and then awarded scholarships, and our other service, health, and educational program. And last but not least, our collaboration with anyone and everyone that is available, that we want to collaborate with you. Next slide, please. Our history, it started back in 1924 when Mary Turner Burrell and a group of young women formed the Business and Professional Girls Club at the Center Avenue YWCA. In 1935, another progressive group of women said, "We want to work together to share our expertise." And that started in New York City, as is now called the mothership of all the clubs. And it's been growing ever since then. In 1951, Betty Allen Graves, the president of the Pittsburgh Club at that time, led the organization to act on behalf of Black women in the community and joined the National Association. Next slide, please. I mentioned leadership, entrepreneur, technology, and service, a wealth of opportunities. Next slide, please. Over the years, we've awarded the Sojourner Truth Award, which is the association or the club's highest award presented to by the local club. You may recognize some of the names on the slide. I'm not going to mention them because I may overlook some of them, but they're very prominent individuals in and around the Pittsburgh area. Next slide, please. COVID-19 made us all think outside of the box, and this is a list of some of our 2020-2021 programs that we had. COVID-19, How to Live, Work, and Survive. That was a combination program with the National Council of Negro Women. Breast Cancer Awareness, our voter outreach program, our activities with the Jubilee Soup Kitchen, where we not only donated money, but on a social distance basis, we collected scarves, gloves, and hats and donated it to the Jubilee Kitchen. We continued with our service outreach with Dress for Success, where members had clothing that we donated to Dress for Success, and we delivered those items on a social distance basis. Human trafficking, a horrible story, but we wanted to be aware of what human trafficking is, the effects, so that we could all be aware of it, because it's sometimes a hidden type activity there. Our annual scholarships that we award, and then our Founders Day celebration that we have at the end of each program year. Next slide, please. There's a photograph of some of our young 2021 scholarship recipients. We're about to release our 2022 scholarship questions to Nequid, and we'll be sending it to NCNW shortly to circulate, and our membership and churches and community groups. Next slide, please. There is the 83rd National Convention. You recognize some of the ladies there. I had mentioned the vocal arts competition. Again, these young men and women would normally not have an opportunity to compete on a national basis and be awarded scholarships. Next slide, please. Our outreach included working with the Black Health Matters Summit as a partner there. You'll see our membership information sessions. We had a Black History session when we were able to meet at the Heinz History Center. And our prior scholarship winners are there also. Next slide, please. Some of the activities in the service area includes a 2020 Technology Institute that will provide you insights on different trends in technology, how to use various applications, and the 2021 Leadership Institution, which is a class and that's taught by a combination of senior members of the association and others who want to share their expertise with everyone. Next slide, please. This is our turkey giveaway with the Kappas. Next slide, please. Our holiday gathering in 2018. Again, this is pre-COVID, so we did not meet the last few years. Next slide, please. our Founders Day luncheon. Next slide, please. And the National Association outside of our national headquarters in Washington, D.C. Next slide, please. Our past projects and activities and contributions from the Miss Ebony Teen, Miss Princess Pageant, the fashion show, our vocal arts. We've made contributions to the August Wilson Center, the United Negro College Fund, the Negro Emergency Education Fund need. We were one of the initial contributors to the University of Pittsburgh African American Heritage Classroom, and the annual celebration at Bethel Church Thanksgiving Day. Not only did we make a donation, but members gathered there and served dinners to the need. In the last few years, we continue to make gift donations or gifts to the various African American food banks around the city. Thank you so much, NCNW, for giving me the opportunity to talk a little bit about the Pittsburgh Club of the National Association of Negro Business and Professional Women's Club. Now, I'd like to read the brief bios of our two doctors who are guesting with us tonight. I'm going to start with Dr. Anita Edwards. Dr. Anita Edwards, MD, MBA, FACP, is a medical director at Highmark Whole Care. She previously Gateway Health. She received her bachelor's degree of Science from the University of Pittsburgh and her Doctor of Medicine degree from Howard University School of Medicine. She later received her master's in business in the Physician's Executive Program of the University of Tennessee. Dr. Edwards also received the title of Fellow of the Academy College of Physicians. She is also the co-chair of the Health Equity Committee, and I'm proud to say Vice President of the Pittsburgh Club of the National Association of Negro Business and Professional Women's Clubs. Our next doctor is Dr. Christopher Allen, MD, FACC, FSCAI, who is Associate Professor of Medicine at West Virginia School of Medicine and an intervention and structure cardiologist at WVU, Heart and Vascular Institute. He is Chief of Cardiology at WVU Medical Wheeling Hospital and WVU Medicine Reynolds Hospital. He received his training in internal medicine at Howard University, where he served as Chief Medical Resident. He was elected to the prestigious Medical Honor Society, Alpha Omega Alpha, in his senior year. Dr. Allen was then accepted into the Cardiology Fellowship Training Program at Howard University Hospital. He completed his training in interventional cardiology at the University of Massachusetts Medical Center. He's board certified in internal medicine, cardiology, interventional cardiology, and nuclear cardiology. One thing about both doctors, both Dr. Edwards and Dr. Allen actively participate in numerous community service activities in the Pittsburgh area, with a primary focus on community education and closing the gap in healthcare disparity, as well as trying to fill the pipeline of minorities in medicine. I want to thank both doctors for participating in the program today. Think Hard, Think Health. We'd like Dr. Anita Edwards to start off with her comments regarding Think Health, and then Dr. Christopher Allen will follow.
Well, thank you, Valerie, for inviting us tonight. And I thank Chris for accepting my invitation to be on our program today. As you say, I'm the Vice President of the National Associations of Negro Business Women, and it's an honor to be on this program. I also would be remiss to say that we both are also part of Gateway Medical Society, which is a society of African American physicians in the city of Pittsburgh, part of the National Medical Association. And our goal is to help with eliminate disparities, health disparities throughout not only throughout the city, but as a national organization throughout the world. So we feel very honored to be able to be here and give this conversation. And as I am watching the information go across the screen, I must say if nothing else is said tonight, we want to encourage everyone to get their COVID vaccine and their flu shot. As we talk about heart disease and healthy heart, one of the problems with African Americans, especially, is that we have more heart disease. And I'll let Dr. Allen get more into the heart disease part and the numbers, but we have more heart disease usually than most other ethnic groups. And therefore, we are more susceptible to morbidity and mortality and dying from COVID than other groups of people. So I think it is so important that we get our vaccines. So um, healthy heart, think healthy, think heart. I think sometimes, especially since COVID has been going on, that we have forgotten how important it is to keep ourselves healthy during this time, especially with females. We probably weren't exercising and eating as properly as we should even before this time, but now that we're more in the house, kids are more around, we have less time for ourselves. We probably are not doing the health things that we should do for ourselves. It is so important that we realize that being overweight and not eating properly has so much to do with heart disease. Um, African American women have, I think, a majority of the obesity. If I remember the numbers, we're about 60% of us is at least overweight. Um, and so that's a lot of people when we carry that kind of weight. And we have to understand by being overweight that we probably have increased cholesterol. We're more susceptible to diabetes. We're more susceptible to hypertension. And these are the things that will lead to heart disease. So, many times, people say, well, what is hypertension? I'm not anxious. I'm not upset. I feel like I'm calm. But we have to understand hypertension is when the blood pressure is elevated higher than what we consider as normal. And normal is, and Dr. Allen can correct me if I say the wrong numbers, but it's usually less than 120 over 80. And then if it's getting higher than that, then we have different levels of which we call pre-hypertension, and then we have hypertension. But we have to make sure that we are keeping those numbers under control. And the way we do that is through exercise and eating properly. We have to, I know my colleagues used to get on me quite a bit, but I've done much better. We have to watch our salt intake. We have to make sure that we're not eating a lot of fried and greasy foods. We have to make sure that we are eating more vegetables, more fruit, eating foods high in protein, so that we are trying to have a proper diet. And then, we have to do some kind of exercise. And I usually try to tell people just do whatever you like. If you just walk for a short period of time, that is more than just sitting in a chair all day long. So if you can get up and walk for 10 or 15 minutes of your day, they tell you, and it's really true, park farther away. I mean, I know you're not out, but when you do go out, if you go out to the grocery store or go get your hair done or your nails done, then park farther away so that you have to walk to get in. Find some things at home, put on some tapes, find some YouTubes. If you're using YouTube right now, then you know how to use YouTube, and you should be able to find some exercises. And sometimes, most of the time, they're very low impact. You can find some low impact exercises that will help you to do some kind of cardiac exercise at least 5 to 6 times a week. So we want you to make sure that you're exercising. Um, you want to make sure that you're eating right. And then I also tell that you need to make sure you're doing some kind of stress reliever, whatever that is for you. Meditation, yoga, reading a good book. Um, they have the peppermint patty commercials. If you just eat your peppermint patty and get away for a moment. I think there used to have also be a Calgon commercial that just talked about getting away. But sometimes we have to make sure that we are just relieving that stress so that we don't have stress. So again, I think I've talked a little bit about hypertension. I also want to mention diabetes. That is so prevalent again among African Americans, and having elevated sugars. And a lot of people think of it as sugar and say, well, if I just cut out the sugars, and they think about if they cut out pop or sweet things or candy, that they'll be okay. But we have to also realize, again, getting back to our diet, that things that are carbohydrates, high in carbohydrates, will cause you to have your glucose go up. So things like potato chips and pasta and rice, all those things are carbohydrates, and they will affect your glucose and make it go up. So you want to make sure, if you're not a diabetic, that you attempt not to be one. So again, watching your weight, exercising, and then watching your diet. But if you are diabetic, then it becomes very important that you get that controlled, because diabetes is basically a cardiac disease. And I'll let Dr. Allen get into that a little bit more if he wants to, but it is almost considered cardiac because anyone who has diabetes already has some destruction of their blood vessels. And so they're already at risk for heart attacks and strokes. So you want to make sure you get your diabetes under control. You want to know what your numbers are. I always tell people, make sure you know your numbers. Make sure you know what your hemoglobin A1C is. Make sure you know what your glucose is. And then again, I already told you about hypertension, so you should know what your diastolic and your systolic blood pressure number is. And then the third numbers you should know is your cholesterol. You should know your good cholesterol, your bad cholesterol, and you should know your total. And even you should know your triglyceride level. So I think that's kind of the basic. I mean, as an internist, those are the basic things we see and that we try to control, and we try to help people manage. Because if we can help them manage, then hopefully they don't have to go to Dr. Allen. But if I can't get it under control and can't manage it, then I send them to people like Dr. Allen. And so I'll let him continue in this talk.
Well, first, I want to say thanks for having me. And it's been a pleasure to share the platform with my friend and colleague, Dr. Anita Edwards. We've known each other for a long time, and Howard University is our old background, so we have a common background. Now, I'd like to speak a little bit about cardiovascular disease. And when you say cardiovascular disease, a lot of people think that it's only heart attacks. Cardiovascular disease spans a wide range of different disease processes, including, of course, coronary artery disease that leads to heart attack, cerebral vascular disease, people present with strokes, peripheral vascular disease presents with problems with their legs and pain in their legs and loss of limbs. And of course, atherosclerotic disease that involves the aorta, which causes thoracic and abdominal aortic aneurysms, and therefore very high risk of death if these have disastrous outcomes. But as you look at the whole group together, none of these four areas occur by themselves. There is a lot of overlap between the different areas. So if you have problems with your legs, you're also at high risk for having a stroke or having a heart attack or having problems with your aorta. And it is the most common, the world leading cause of death, both in the African American population and the general population. We have about 4.8 and 4.9 million deaths per year in women and men. So a lot of times women think that heart disease or atherosclerotic heart disease is not for them. They're more scared or more afraid of having breast cancer. But if you take all the cancers together and lump them together, they are not even close to what we see as far as the impact of atherosclerotic cardiovascular disease has on them. So yes, we are afraid of cancer, but I think you have to think heart, because that is a leading cause of problems. And there are a lot of traditional risk factors. I like to think about heart disease and how do we prevent it. It's what we call primary prevention. And as Dr. Edwards spoke about a couple of these things that we do to primarily prevent you from getting there, instead of secondarily try to correct things after the event has occurred. So primarily, we like to think of it as A, B, C, D, or E, and E. A, B, C, D, and E. So the letter A stands for assessing your risk. When you go to your doctor, assess your risk for having heart disease. And this risk might be the habits that you have, means high blood pressure, diabetes, lack of activity. And why it's important to assess the risk, because it's not only the people who have high risk who have these events. If you look at the data, more than 60% of the people who have their first heart attack or stroke or lost a digit or a limb are in people who are not high risk. So that's why it's very important that you assess your risk to exactly find out if you are at risk. If you have a family history of heart disease with relatives, male relatives less than 55 and female relatives less than 65. If you have abnormal calcium score in your heart or ankle-brachial indices, if you smoke, if you're overweight, you have to assess your risk for having heart disease. And like I say, A, B, C, or D. So A is assess your risks. And if you have high risk, antiplatelet therapy and aspirin is very important if your risk is greater than 10%. B, your blood pressure. Dr. Edwards spoke about your blood pressure being less than 120, but interestingly, the risk for heart disease or cardiovascular disease starts going up, or cardiac event starts going up when your systolic, the top number is over 115. So you cannot be comfortable with your blood pressure and taking it for granted, because your risk for a cardiac event starts increasing after your blood top number, the systolic blood pressure, is over 115. So blood pressure. And Dr. Edwards outlined the goals that we want to get to. C, cholesterol. You can do that with lifestyle interventions, looking at your diet, with or without medications. And C also stands for cigarette smoking or tobacco abuse, to stop smoking. D, weight management and diet. And we'll talk a little bit more later about the diet that I think or has been shown to be the most beneficial in preventing a lot of cardiac, cerebrovascular, and other events. Diabetes prevention and treatment is also D. So if you're diabetic, you should take it very seriously, because you're now higher risk for having heart disease or stroke. So you should really pay particular attention to what you eat and when you eat, and knowing what your hemoglobin A1C is. In addition to your LDL cholesterol and your blood pressure, I strongly support what Dr. Edwards says. I like to say you have to know your numbers. You got to know your numbers. Know what your blood pressure is, your top number. And whenever you go to your doctor and you have your blood pressure taken and they're saying your blood pressure is good, your next question will say, what does good mean? You got to know the numbers. You have to know your numbers, because then that will tell you exactly what your risk profile is. So that's the E, exercise, as Dr. Edwards alluded to. Regular exercise is very important. Now, what I like to tell my patients is that you exercise, you go to work, and you sit all day at the desk. That's not good. Every 30 minutes, you should really get up and walk around a little bit, move around a little bit, so that you can keep moving. Because if you sit at your desk all day, that probably negates the exercise that you did that morning. You're now sedentary, but you're now sitting at your desk for 8 hours. You have to get up and move around a little bit. So move around every 30 minutes. Just get up, walk to the filing cabinet, walk somewhere, and come back. Okay? So that's what I have to say about the A, B, C, D, and E's for prevention of heart disease. And I'll answer the questions next.
All right. You've touched upon, both of you, so many different things. One question, more and more when I go to see my physicians, they want, or why is it important to know and share my family health with my doctors? As you know, most African Americans, Blacks, are very confidential about anything. And our generation, it was don't ask the question or anything else, where we have limited historical information on our immediate parents. We do, but the generation beyond, their grandparents, great grandparents. But why should we know that information and share it with our doctors?
Well,
go ahead.
Go ahead. You want to take it, Chris?
No, go ahead. Go
Okay. So I'll do the brief, and he'll probably have a longer. But a lot of this is family history. A lot of it runs in your family, and I like you, Valerie. I always said it's odd, but until you develop a disease, nobody else in your family ever had it. And then once you announce that you have it, then everybody all of a sudden can tell you all their stories about how they've been dealing with this illness. But so many times we would be able not only to prevent heart disease, diabetes runs in the family. So that is something that is genetic disposed. If someone in your family has diabetes, especially your parents, especially type 2 diabetes, not trying to get into all about the diabetes, but there's type 1 and type 2. And with type 2, it is definitely seen more often running in the family. So therefore, if you know your family have it, then that means you need, as he was talking about, assessing your risk, and then you need to be doing more to try to prevent it. Doesn't mean you have to have it, but it just means that you are more likely to get it. We know that's true of cancers. So there is so many things that if we would share our family history, not only are we able to prevent more, but then our doctor also is able to do a better assessment of us when they are looking for our risks and trying to help us in preventing disease.
You see,
Thank you, Dr. Evans.
Your risk there's a very strong familial association with some of the risk factors that you have, as Dr. Edwards said, and that's why it's important to share that. A lot of times, our community has been very reticent of sharing risk of cancer, strokes, and heart disease. But it's important because forewarned makes you more prepared to face whatever is coming down the line, because then you start to correct all the things that will now decrease your risk, because as the risk factors add up, they don't add up like 1 and 1 makes 2. They add up exponentially.
Mm-hmm.
So if you go from 1, if you add the more risk to it, your chance of having the disease exponentially increase. So you go 1 + 1 goes to 10. So it's and then if you add another risk to it, it just keeps increasing. Now, genetically, you cannot change who you are genetically, but you can change all the other things, all the modifiable risk factors. so that whatever else happens, and if God so has it that you do develop disease, you've done everything that you need to do. You've been a good steward of your body to prevent that from happening.
Thank you both on that. What is sudden cardiac arrest? I was watching the CBS morning show this morning, and this was not, I've never thought about it before, but what is sudden cardiac arrest?
Sudden cardiac arrest is a complete cessation of electrical activity in the heart. The heart stops beating. And that can be due to a number of different things. It can be due to what we call an irregular heartbeat, which goes so fast that the heart just goes into standstill. It could be due to a large heart attack. It could be due to a large pulmonary embolism. But anything that suddenly affects the heart function and causes a decrease in the heart muscle function and the contractility of the heart or electrical activity of the heart can result in a sudden cardiac arrest. And the cardiac arrest is when the heart stops beating, and therefore you collapse and you have to be resuscitated.
All right. I had another question, but we have a call on the line. Caller?
Hello? Am I on?
Yes, you are. Thank
Hey,
you for calling.
let me say good evening, and I want to say hello to my friend Dr. Edwards. It's good to see you. I'm one of the parents who were active in the Gateway Medical Society, and you were very involved. I just wanted to shout out and say thank you for the many, many hours and mentoring that you were able to give to our son. So thank you very much for that. But my question is just a brief note on a piece of information to see if both of you were aware of. The Surgeon General came out with a report, I want to say last month, no later than the end of November. But the title of the report was, in so many words, the mental condition of America's youth. And I thought it was a telling report because in the last year, we've seen our young folks involved with some really crazy things in these schools and in the streets and the violence, and it's like they have no feelings. This report highlighted that this pandemic, the violence on the national scene and the politics in Washington, it's taken its toll on our young folks. And I'm just wondering if either of you are familiar with it. If not, it might be a great document just to have in terms of when your patients come through, on top of what they're there to see you for. According to the Surgeon General, this is also going on with our young folks. And I've been telling everybody about it because I think it's a hidden answer to a lot of the things that we are witnessing. And so I've been encouraging school districts to get it and to share it and so on. So I just was curious to know if you were familiar with it. If not, you can actually access it online. And I don't know the correct title, but I know it was the impact or the mental status of the Americans' youth. And I just thought it was a great piece of information. But I'll just hang up and listen to your response. But thank you so much, and it's another wonderful show. Thank you.
Thank you. Either doctor, do you want to respond?
Well, I can say I haven't heard of the actual report. But what I can say is that it's not a shocking report. As we are talking about heart disease, this is usually not which causes mortality in most of our youth. For youth, usually it is trauma or some kind of accident, whether it's suicide, car accident, and we have seen so many shootings here recently. So our young people, and it's a shame to say, probably don't have to worry about heart disease as much as they do as the trauma they have on the streets. So as he said, that's a whole different conversation. We could talk about that probably for another hour, but it is very important that we try to address, as he said, Gateway Medical Society does have a mentor program where we try to work with African American males to try to help them work into the pipeline for medicine, but also to help gear them just so that they will be more interested in academics and trying to keep them off the street.
And mental stress is very important. It can result in significant heart disease, and it can present as heart disease, not in the young people at that age, but mental stress contributes to a whole lot of different outcomes. And I think that is very important that we have to address it for sure.
And I had even mentioned earlier about, especially as you get older, that is why you do need to know some kind of meditation or some relaxation, because we are seeing that during this pandemic, domestic violence, abuse, all these things are on the rise. Suicide is on the rise. But then we have been seeing more heart disease and more diabetes and more cancers. So it is very important that we learn to deal with our stress, deal with depression, deal with anxiety, because all those things can affect you not only mentally, but they affect you physically.
Thank you both. I know that I'm heartbroken sometimes when I hear in the news that a young person has collapsed and died, and they're not quite sure the reason for it. And later it might be attributed to a heart condition. How can that happen? I recently was aware of someone, he was an athlete. He was 16 or 17 years old, and he collapsed on the court. I do know that our young athletes get physicals on an annual basis, and sometimes these horrible accidents occur. Maybe you can give us a little information on what parents, friends, and others should be looking at for young people.
From that standpoint, I think it goes back again to knowing your family history. Okay, it's very important. Sudden cardiac death among these young athletes usually is an irregular heartbeat. If you remember way back, I'm sure I didn't know what caused that young man to die, but in the late 80s and late 90s, there was this great basketball player who was going to go play with from University of Maryland. We were in DC at the time, and he was going to be the star player to replace Larry Bird in Maryland, and he collapsed and died on the court, and that was from an arrhythmia. And it is from that arrhythmia is most likely from a congenital heart disease, and it's a genetic heart disease, I should say, not a congenital heart, a genetic heart disease, which would predispose them to arrhythmia. People who have the most common cause in that setting could be something like what we call a hypertrophic cardiomyopathy, where the heart muscle gets thick out of proportion to what the blood pressure is. And there is a lot of scarring that occurs inside the heart, and that lends itself to arrhythmias. And young people who have hypertrophic cardiomyopathy have been prevented from, have not been allowed to participate in athletic activities in that sort of fashion. And they can do gentle activity, but no competitive sports, either in college and high school or in the pros, because of that risk for dying suddenly. Yes.
And Valerie, just on a personal note, I want to say, listen to your children. Lots of times we think that they're lazy, but if they tell you things like my heart's racing, or I feel short of breath, or I'm getting real tired or fatigued, you need to take that seriously, because that may be the only signs that they're going to have that something's wrong. And I'm going to tell a little personal story. Being a physician, I don't listen to my didn't listen to my daughter very well. And so I remember for quite a while, she kept telling me her heart was racing, her heart was racing. And I kept telling her to stop the caffeine, not to do this, you're not exercising enough. And so finally, we told her primary, and she sent us to a cardiologist. And she ended up having this irregular heartbeat where sometimes her heart was up to 240 beats a minute. I don't even know how she was standing as a physician. I didn't know how she was even standing. But we have to listen to our kids because they don't have the symptoms of adults, or they may can push through something that with me, I would have probably passed out with that heart or definitely been on the floor. But with her, she was able to still push through. So our kids have a stamina that we don't have. And that's all I want to get to the point is. So you have to sometimes listen to them, when they're especially wanting to do activities, you need to listen if they're telling you they're having some problem so it can be addressed.
Once again, that's why it's so important to know your family. To know your family history is very important because family history of relatives dying suddenly is very important information for your physician.
So, are the symptoms for heart disease or stroke different in women than men?
No.
Right.
No. I can say that women present a little differently, but the most common presentation is the same as they do in men. They still have chest pain and, exertional shortness of breath that gets better when the exertion stops. So all the symptoms are related to some level of activity and gets better when the activity stops. And that is usually a tip-off. When you go to the doctor and say you have chest discomfort, the first thing they say, what are you doing when this occurs? And if it's due to activity, then they put the pen down and listen a little bit more. Because that is one of the hallmarks of an abnormality in the blood supply to the heart, or abnormality of the heart muscle function, or abnormality of the squeezing capacity of the heart. The shortness of breath is usually with activity, and when you sit and rest, it gets better.
We talked about before sudden cardiac arrest, but what can I do as a lay person if someone goes into cardiac arrest? Call 911. What should I do beyond that? Just watch them?
No. Well, there are protocols that have been shown to work. Okay, and it's very important to understand basic life support or advanced cardiac life support. So, as part of the whole training, they tell you is the first thing you do, you say call 911, and then you feel for a pulse. If you have no pulse, then you start to cardiac massage, but you have to know how to do cardiac massage. And that's why it's important for people to learn basic life support and advanced cardiac life support. So you can at least implement some sort of resuscitation methods while 911 is coming.
So to that point, everyone should try to take a CPR course if they can, especially if you have little kids, especially if you have pools around. You should try to do a CPR course so that you learn how to do these techniques that Dr. Allen is talking about. A lot of facilities will even have what they call defibrillators, or the little boxes. And so if someone is in having a cardiac arrest, those are available in a lot of facilities. So again, that's why you want to let someone else know that someone's in trouble so that other people can come and bring equipment to you while you're waiting for the paramedics or the whoever's coming from 911.
Yeah, it's very important, very important. You have to learn basic life support so you can start resuscitation while you wait. Because the earlier resuscitation is begun, the better the chances of the person surviving.
We have another call on the line. James, are you on the line? Thank you for calling in this evening.
Yes, I am. I want to say I'm enjoying this show very much. And I just have one question. If someone's 99 years of age, would it be safe for that person to get a pacemaker? I'm going to hang up and listen. Thank you.
Well, it all depends on what's the indication for the pacemaker. Now, and also depends on the condition of the 99-year-old. There's some 99-year-olds who are active individuals, walking around, taking care of themselves, living by themselves. And yes, I would put a pacemaker in them if they have heart block and they are symptomatic. If they're having symptoms like passing out and you don't want to fall and hit their head, a pacemaker will prevent that from happening. But if they are now totally incapacitated and if they have already voiced their living well to you, I think that you have to respect them. But yes, it all depends on what the scenario is.
And I also want to preference anything Dr. Allen and I are saying. Please always talk to your doctor. Realize we are talking in general conversation. We don't have all your history. We don't know what medicines people are taking, what other family history they have. We don't know the full story. So we are giving you general information. We're giving you enough so that you can advocate for yourself when you go to see your doctor. But you should always talk to your doctor about your specific case, and you want to be educated when you go. So that's what we hope that we're helping you with tonight.
Can you discuss what impact positive thinking may have on heart health?
Well, that's one to throw out to us, Valerie. Okay. Well, just positive thinking. I mean, I think that goes along when we were talking about relieving the stress, just having a good outlook. I think many people don't know how much their mentality affects their health. There are studies out there now that talks about how prayer helps your health, how people have gotten better because of prayer. There is studies that show that when people are meditating, how their blood pressure goes down. So positiveness definitely will make your health better. Whereas if you're having too much stress and things are negative in your life, these are true stressors. And I don't want people to ever think that, like, people say thought hypertension before meant that they had to be hyper, or they had to be stressed or angry, and that's when they had hypertension. You can have hypertension and be sitting very calmly, but we do know that increased stress in your life makes you more susceptible to diseases. And so therefore having a very positive type life. There's even studies with people with not just breast cancer, but cancer in general, when they go out and they start giving more, and they instead of just looking at what they can receive, but they have gone out and done donations and helped others, how their life actually improves. So we definitely know that having a positive outlook on life will definitely help your health.
The Association of Black Cardiologists had a statement of 7 steps to a healthy heart. And one of those steps that has been shown to a healthy heart is a faith-based step. And you found that people who have that active faith connection, attend a church or attend a synagogue, would have that faith connection, they do live longer.
How difficult is it to get therapy, counseling, and other medical intervention when you have a heart condition or heart disease?
It's not difficult at all. I think you have to, as Dr. Edwards say, you have to be an advocate for yourself, okay? In minority populations, we've found that people don't get referred as much they don't understand what their numbers are as much, and therefore they don't get the benefits of these different therapies. So you have to be a good self-advocate when you go to your doctor. As one of the things I said earlier is that if you go somewhere and to your doctor and they say your hemoglobin A1C is okay, what does okay mean? Is it 9? Is it 7? Is it 6? You should know your numbers. So you have to be a self-advocate. You cannot go to a doctor's office and walk out of that office without understanding fully where you are in relationship with your health is concerned. You have to understand. And for someone to say your blood pressure is okay, your sugars are okay, or your cholesterol is okay, that's not good enough. You have to know what that okay means. So that's why it's very important for you to be a self-advocate. And that's what we're trying to do here today, is to make you a self-advocate. They say a well-informed consumer is the best consumer. That's correct.
And I agree with Dr. Allen. It's not such a difficult to get care. I just think we don't always know what to do when we're in the doctor's office. If you can, take somebody with you. One, if they are telling you something that you really need to know, someone else has heard it so that when you leave, you can remember. If you can't take someone with you, then write it down so that you can repeat it to somebody when you have left that doctor's office. Something else, you should be able to repeat what the doctor said, and then the doctor should be able to repeat what you have said. I know a thing that I always do is after I've heard someone give me their history, I'll say things like, well, I believe you're trying to tell me. And then I try to say it back to them so that they know that I understand what they say. But then I also ask them to repeat what I've just told them as directions about taking medicines or having tests, because it is very important that communication goes on in the doctor's office. So I don't think it's usually very hard to get care. I think the problem is developing that relationship with your caretaker so that you have trust between the two of you, and that you can trust what they're saying to you, and you can. And then it's important to do what they say. I think so many of us walk away not saying. I was talking to a gentleman today, and he was put on a new medicine by his doctor. And the medicine was working very well, but because of that, he had made some other adjustments in some of his other medicines. He just decided to do it on his own. So I was kind of begging him, please call your doctor and let them know that you've made these changes, because this is a relationship between the two of you. And if you both don't know what's going on, then the doctor can't adequately take care of it. So.
All right. Thank you, Dr. Edwards and Dr. Allen. You've given us a wealth of information to take back with us, to be our own self-care with our doctor. We want to listen to our doctor and share information as much as possible, and having open lines of communication. I want to thank both doctors for participating in the program today. Think Hard, Think Help with the Rankin, Mon Valley, Pittsburgh section of NCNW, and our audience for joining in the program. The next program will be on February 4th, 2022 at 6 p.m. Have a good evening, and thank you so much for your time. Good night.
Good night.
Good night.